March 9, 2020, 1 year since Mayor Isko Moreno announced class suspension and placed Manila in quarantine due to the growing cases of COVID-19, which left the Manileños to question how long or how short the city would be observing the strict quarantine measures. Now, on its 1 year mark, we are left to work and continue despite the tough changes that the country has been going through. Different universities have no choice but to opt for online classes to continue pursuing their students' education. Now, still in these trying times, accompanied with losses and the hopeful tomorrow for the vaccination, the fact remains that we are still facing the screen and trying to work on our digital devices. Online classes indeed have been taking a toll on most of the students. Today's pandemic and online learning is not worth being called a challenge. Hence, it is a struggle. It has made it difficult for the youth to thrive in their years of supposed fruitful learning. We still cannot remove the equation that in today's class setup, the mental and physical health aspect is affected. Considering the effects of online classes on one's physical health, back pain, eyesore, shoulder pain, and headache. Today's episode of Lifeline will bring you insight on relieving this physical stress contributed by the online class setup. I am Hansko, your host for today, and join me together with the experts as we find relief on the body aches and become knowledgeable on the needs of rest and recovery of our bodies. This is Lifeline. We improve our lives by feeding our minds. Spending multiple hours on the screen is not new to a regular online student. Our eyes are continuously exposed to the blue screen as we communicate and complete our requirements in this online setup. Together with us is a Thomasian professor and alumna from the Faculty of Medicine and Surgery, a chair of the Philippine Academy of Ophthalmology Distance Learning Program, and the Community Ophthalmology Committee, and the Philippine representative to the Korat Thailand course on Community Eye Health Training Program under the WHO collaborating agency, Dr. Maria Victoria Rondaris. She will explain and discuss how we could rest our eyes and have a possible healthy routine with our gadgets throughout the pandemic. Good day, Dr. Rondaris. We are delighted to have you in our show. And we are looking forward to getting to know the insights that you have. Before we start, Doctora, how are you? How are you doing?
I'm fine. It's lunchtime. I hope I'm not keeping you on your lunch. So.
Oh, no, of course not. All right. Okay. Thank you, Doctora. So now we just have several questions for you since we want to know how can we take care of our eyes in the middle of all this pandemic, online setup, and everything in between. So first, Doc, what are the possible negative effects if we are continuously exposing our eyes on the screen?
Okay, so ask yourself, how many hours do you stay online, diba? And then check your distance. How far are you from your computer or from your gadget? Okay, and then also look at your workstation, your environment around you, and lastly, check your lighting, the type and location of lighting do you have. So all these are factors that can lead to headache, can lead to nape pain, okay, improper posture, no, and then it can also lead to dry eye because as you go through with your online, with your learning, with your gadget, whether it's computer or phone, you forget to blink, okay, and when we forget to blink, it doesn't. It leads to dry eye. Okay, so the tear film in front of our eye gets to evaporate faster. Okay, and then you can also have an extra burden on your eye muscles because you're trying to focus on a near object. So it's like also nung time namin it's pocketbook. This time it's your gadget. Yun. So you can have headache, and the syndrome of this is called a digital eye strain. Yun ang tawag doon, DES, digital eye strain, or some people would call it computer vision syndrome. Yan.
I see. DES or computer vision syndrome.
CVS or DES, digital eye strain. Yeah.
I see. Okay. Doc, is there a specific number of hours on the continuous exposure of using gadgets? Is there a time frame, and how can we know that it is time for our eyes to rest?
Okay, when you feel those symptoms, then normally you should rest already. But the physiologic time frame that an eye can focus at near, so whether it's your dati uso cross teaching, ngayon it's online teaching, and then pocketbook, anything that near work, the physiologic time limit is 30 to 40 minutes. So after 30 to 40 minutes, you should rest your eyes. So they recommend, and actually we recommend, the 20-20-20 rule. So every 20 minutes, take a rest and look at something far, 20 feet away for 20 seconds. And then you can go back to your work again. So normally, we don't make pansin, di ba? We don't, 20 minutes na, we have to do it, 20-20-20. Because some people can stretch their work to 30 minutes or 40 minutes. Yeah, but the rule is 20-20-20. Remember that. So that's looking far, looking at the distance is more of a rest for our eyes than looking at near.
I see. It's an interesting rule, Doc. So again, correct me if I'm wrong, 20-20-20. For every 20 minutes, you rest your eye by looking
far
for 20 seconds.
Right. So sandali lang naman yan. It's not going to affect your work. No?
Mm-hmm.
It's just 20 seconds every time.
Right. I see. Do you do that, Doc?
Oh yeah, I do that all the time.
Oh, okay.
Even when we're talking right now, you can always look at another place that's already for 20 seconds, and then you go back to the screen, and that's already a rest for your eye.
Yes, I see. Well, hold on, guys. I'll just rest my eyes. I'll be back after 20 seconds. No, I'm just kidding. Okay, Doc, thank you for that. As an online learner, the moment that we wake up, we open our phones, computers, or laptops. Is there any other way for us to build a healthy routine to keep our eyes healthy?
Well, of course, there are already tips that you can practice once you're already awake. First is look at your lighting, adjust it. Okay, your light should be not above you. Okay, should just be right beside you, so that the reflection of the light will be towards the page or towards the device that you are using. Okay. And then, if there's a need, let's say it's evening, di ba uso na ngayon yung, what do you call that? That ring light?
Yes, actually I'm using it right now, Doc.
Okay, I'm not using it. I'm just using the light from the outside, okay? So, kasi minsan, all those things that are in front of you, like task lighting, is important. You should have, especially in the evening, isn't it that you notice here in the Philippines, our evening light, our light in the evening, is much dimmer than if you go abroad and you look at the lights of the other countries to diba?
Right. Especially along the streets, Doc. It's true.
Yeah. Because we're using yellow light, mas maganda sana, medyo whitish yellow or white light, so that it's a little bit brighter. So that's the kind of light that you would want to use when you're, doing near work.
I see. Okay, thank you for sharing that, Doc. And now I have my last question for you, or last request. Can you give your message to us online learners on how we could establish a healthier routine to keep our eyes sharp?
Okay, so first you to adjust your light so that it can reduce your glare. Clean your laptops or your devices because your fingerprints or dust can also reduce your vision clarity. And then if needed, increase the text size. Wag masyadong proud na I can read small stuff, di ba? And then I'm sure you have questions on blue light, okay? Blue light is everywhere. It's not only on your devices. In fact, sunlight is the greatest source and the biggest source of blue light, and even your mga fluorescent light at home.
Mm-hmm.
So there is no solid evidence that we have to buy special eyeglasses.
Anti-radiation, right?
And it's very expensive.
Yes.
On the 4 questions that I told you, how many hours did you spend? How far are you? You should be like 24 inches away from your laptop or your device. And then your workstation, your proper lighting. So if you have you're typing something, better to have your document beside your screen so that you don't have to do shifts in your vision every time. And then lastly, of course, you have to go to your doctor, your eye doctor, your ophthalmologist. Well, preferably once a year, but kung wala namang problem, pwedeng every 3 years. Okay? For your eyes to have your eyes checked, and also eat nutritious food. I hope I did not miss anything.
I think you did not, Doc. And I'm sure our viewers already took down notes on all of this. Okay. So again, thank you so much, Doctora, for giving us such insightful tips and tricks on how to take care of our eyes. So thank you so much, Doctora Rondaris. And thank you for gracing our show. Your insights have been very helpful. Thank you for encouraging us take care of our eyes. Once again, thank you so much, Doc, and please stay safe.
Thank you for the invitation. And taking care of your eyes is very easy as long as we're conscious of it.
Right, absolutely. I'll take note of that, Doc. Taking care of your eyes is easy as long as you've been conscious for it. Yeah. Yes. Okay. Thank you, Doc.
Thank you.
Sitting in front of the screen and finishing a pile of work and requirements lead us to develop back and shoulder pain. Stress could also be a factor of this. Together with us is the president of UST-CRS Physical Therapy Society, Jann Lyndzey Marcelo, as she will share her expertise on how we could improve our posture and ease body aches. Good day, Zay. We are delighted and very lucky to have you in our show, and we are also excited to hear your advice.
Good afternoon, Hans. Hi, how are you doing?
Hello, I'm fine. Thank you for asking. How about you? How are you?
I'm doing good, thank you.
Okay, great. So, Zay, of course, you also have a fair share of experiences of back pain during online class. Are there quick remedies that you do to ease the back pain?
There is actually. This is something that I learned only recently, last semester. During our course, we took a course called Physical Modalities, in which we learned about the modalities that physical therapists use. And what I learned to do was that to use a hot moist pack. This is something that we can buy from drugstores like Watson's or Mercury. And I just wrap it in a towel and I put it on my low back area, which is usually where I experience pain after sitting at my desk for so long. So I do this for 15 to 20 minutes maximum. And I find that this really helps because it's somewhat relaxing also because I get to take a break from ACADS. So that's one quick remedy that I do.
Right, I see. Thank you for sharing that. I'll do that after this show. Definitely. Okay, now how can we correct our posture to lessen our back pain? Are there stretches or exercises that we could do?
One way that we could correct our posture is that, like what Doc said earlier, is that ensuring that our workplace setup is ergonomic so that
Mhm.
it's very optimum. So it doesn't make, so we should make sure that our workspace setup doesn't make us stoop and that we have proper posture. So another, for the stretches, there is actually one stretch, a stretching exercise that you could do to stretch your low back muscles. So what you could do is you lay down and
Okay.
then you bring one of your knees to your chest first, and then you pull the other leg up. And then you pull until you feel a stretch in your hip and on your lower back muscles. So you should do it this way. You should do it one by one, because if you do it simultaneously, that's going to cause a lot of stress on your back.
Mhm.
So you can do this stretching exercise for at least 30 seconds and repeat it 3 times or 3 sets. So that's for the stretching. And for the exercises, what I could say really is that strengthening your muscles really will help, especially your core muscles or your six-pack abs and your back muscles, because this will provide more support and therefore lessen the incidence of back pain.
I see. Thank you for that, Zay. Now, earlier you said about back pain. What are the long-term effects from poor posture? Is back pain one of it? Well, I assume back pain is one of it. Am I correct?
Yes, you're correct. Of course, back pain really is one of the long-term effects from that can stem from poor posture. Really, there are quite a lot actually, and one of it could be also tightness. It could cause tightness in our muscles, which isn't a good thing. Also, since this tightness can hinder our day-to-day activities because it's going to limit the motion that we can normally do. So this can really be a nuisance to doing our everyday activities like cooking or simply just doing schoolwork.
Mm-hmm. Right. And from what you said, I think it's really all about preventing bad things happen in your body, right? Okay.
Prevention
So
is always better than cure,
yes,
as they
exactly.
say.
Exactly. Prevention is better than cure. Now, here is my next question. When is the time to consider therapy? Do we have to invest in massages or those luxury chairs that claim to prevent back pains? What are your thoughts on that?
I can't really say when the best time is to consider
Mm.
therapy, since this could be very different for each person, you know. But I think the common misconception that people have about therapy is that when there's something already wrong with our body, then that's the only time that we should consider going to therapy. But really, Hans, the fact is that we can go to therapy even if we don't feel anything wrong with our body, because
Right.
PTs, they not only help rehabilitate patients
Mhm.
and guide them through the process, but they can also help you improve the quality of your life. You know, as PT students, we are taught that primary care, or like what we said, primary prevention is better.
Mhm.
So, because ideally, improving health and wellness is one of the main things that we encourage.
Right, right.
So, to answer your second question, from the perspective of second year PT student, I don't think that we have to buy or invest in these luxury chairs, because for my limited knowledge about these are quite expensive, no? So there are ways that we could do it in the comfort of our homes that require less expenses. So one that is very applicable to us these days is that we have the tendency to sit in our chairs in front of our computers for the whole day. Even I'm guilty of this because, you know,
Me
Ahad's
too.
life. I know, Ahad's life. So this is really detrimental to our body, because really any prolonged posture is bad for our body. So when you're studying, you should get up every now and then
Mhm.
do a bit of stretching, walk around the house, you know, play with your dogs or your pets if you have, just movement really is key.
Yes.
So that's
I see. Okay, thank you for sharing that, Aze. I know posture, especially in today's time, plays a vital role since we are in an online setup, right? So now I just like to ask, since you are the president of the Physical Therapy Society of CRS, does the council have plans on, I don't know, publishing some tips or publication materials regarding this topic on how to prevent back pains and the like? Do you guys have plans?
we do actually. We have community development activities planned out for this year, and these are not only geared for us students, but also for teachers, because like us, teachers are also experiencing this problem of sitting in front of the computer for a very long time. And so yes, we do have plans to publish some of these tips and seminars as well.
Yes, I see. That's good to know. So now, Zay, what is your message to us, to your fellow youth, for us to not take our body for granted?
Okay, so just a little sharing.
Sure.
Being in the PT program, we study the human body almost every day since my first year. What makes our body tick, the mechanisms, and it's really given me a whole new appreciation for it, because our body is so complex and it's connected in so many ways that even I was very shocked to know when I was back in my first year. So I think my message is just that exactly. So we shouldn't take our body for granted, because as we mentioned before, there are a lot of long-term negative effects that could stem from not taking care of our body properly.
Right.
And these negative effects, they can get in the way of us living our life to the fullest or in the best way that we can. So my advice is to just take care of your body. While we're young, let's be active and go to the gym. Of course, not now because of the pandemic that's going, but there are plenty of home exercises and home workouts that we could do in order to keep active in this while we're quarantined. So
okay, thank you for that, Zay. Now, I just like to know, as a student of a physical therapy program in our university, what do you do? Can you share some of the things that you do to prevent, some body pains?
some body pain. Oh, okay. Actually, this is something as well that I just learned recently this semester.
Okay.
Like what I've mentioned earlier as well, I think I just do stretching every morning after I wake up. I find that really helps. And then usually because I have classes the whole day synchronous most of the days, yeah. So what I do is whenever I have a quick break, I just stand up and then walk around the house and then do a bit of stretching, and then I go back to sitting on my desk. Yeah.
Okay, thank you for sharing that. So basically, well, I think I could also speak for all of our viewers right now. What we should do, correct me if I'm wrong, is that we should stretch in the morning, walk around, circulate our blood along our body, and do body movements. Is that correct?
Yes, that's correct. Movement is key. Always remember.
Right. And together with that, prevention is better than cure, guys.
Of course, prevention is better than cure.
Yes. Okay. Go ahead.
Approaching therapy is always going to be better if you approach it as a client that wants to improve their health rather than a patient going for treatment. So that's why we should not take our body for granted.
Right. I agree with you. And Zay, it doesn't cost a lot to do body movements, right? Literally, you just walk around your house and I think you're good to go, right?
It's free.
Yes, exactly. Okay. It was a very fruitful discussion with you, Zay. We learned so much on how we could take good care of our body. Thank you so much, and please stay safe.
Thank you for having me, and stay safe.
Welcome. Stay safe. Today's online setup is not easy. It pushed us to our limits, drained us, and it even had us question our own capabilities. In today's episode of Lifeline, we are reminded to take care of our well-being and to know when to pause. Sometimes a pause is a need for us to continue. Our body needs recovery too. Even though sometimes we feel that we are ripped from the years of our youth, we have to remind ourselves not to overwork. If we do not find time to rest our body will choose the time when to rest. Pahinga muna, bukas lalaban muli. Once again, I am Hans Ko, and this has been Lifeline. We improve our lives by feeding our minds. Take care of your health. Until next time, Tigers.